The White House is providing some contradictory information about the health of the President of the United States. He's at Walter Reed Medical Center right now being treated for COVID-19. Just after midnight on Friday, the President tweeted that he and the First Lady had both tested positive for the coronavirus and that they were both immediately going to begin the quarantine process. Less than 24 hours later, the President was transported to Walter Reed Medical Center in Bethesda, Maryland. The White House said the move was made out of an abundance of caution and that he would receive further treatment and monitoring of his symptoms. According to a source close to the president, Mr. Trump's vitals were, quote, very concerning after his diagnosis and that the next 2 days will be critical for his recovery. This information comes as a stark contrast to the tone set by the president's medical staff during a press conference Saturday morning. They said that the president had been doing, quote, very well. Let's take a listen.
At this time, the team and I are extremely happy with the progress the president has made. Thursday, he had a mild cough and some nasal congestion and fatigue, all of which are now resolving and improving. Thursday, no oxygen, none at this moment. Yeah, and yesterday with the team, while we were all here, he was not on oxygen.
During the press conference, the president's doctors continually emphasized that Mr. Trump was not currently receiving any supplemental oxygen. However, sources have confirmed that the president did in fact receive oxygen on Friday prior to being taken to the hospital for treatment. It is not clear if the president had any trouble breathing, and we are told that this may be a default treatment for patients in this situation. I'd also like to be very clear on this point. Supplemental oxygen is not the same as being on a ventilator. That is a much more serious situation. Supporters of the president gathered outside of the medical center to pay their respects to Mr. Trump. The president has not made any public appearances since his hospitalization. But his Twitter account was active on Saturday. One tweet says that he was feeling well and gave thanks to the doctors and nurses caring for him at the facility. CBS News political reporter Grace Seegers joins us now to discuss all of this from Alexandria, Virginia. Grace, as we heard, President Trump's doctors say that he is in good condition and responding well to treatment since his arrival at Walter Reed Medical Center. However, a background source close to the president has called Mr. Trump's vitals very concerning. This is in contrast to the doctor's message. Why are we seeing this disconnect surrounding the president's current health status?
It really speaks to the general confusion that the White House has been sowing since the president announced that he and the First Lady had tested positive for COVID. Reporters were given very little information on Friday. There was very little notice before we knew that President Trump was going to Walter Reed. And now we're seeing this disconnect again between what the doctors are saying and then just moments later, the source sent the quote to reporters just moments after the doctor finished speaking, saying that actually his vitals weren't looking as good as the doctor suggested. Now, what we know about President Trump is that he hates to show any sign of weakness, and he hates to be perceived at all as anything other than from a position of strength. So for him, being seen going to the hospital is really something that's very difficult for him, and he would want to present strength. So that might explain why publicly you're hearing the doctor saying everything is fine, but privately there may be more concerns.
Yeah, I think that for a lot of our viewers, that's part of what is problematic, that not only is there this disconnect, but the specific instances in which they are not providing information leads to speculation. In particular, let's talk about the oxygen question. It has been confirmed that President Trump was administered oxygen at the White House on Friday before leaving for Walter Reed Medical Center. As I explained to our viewers, this might just be a standard of care, a precaution that was being taken because this is the president of the United States. But we heard his doctors really go at great lengths to dodge the question. What more can you tell us about this, Grace?
It really was striking when reporters were asking Dr. Sean Conley over and over again, has the president been on oxygen previously? And he just kept sidestepping the question. Finally, he said, as you played earlier, that he had not been on oxygen on Thursday and had not been at Walter Reed on Friday. But that did not mean that he wasn't on oxygen while at the White House. And then CBS News, as he said, then did confirm that the president was on oxygen while at the White House. So there was a lot of unnecessary confusion. It was glaringly obvious that Dr. Conley was omitting something. And honestly, it seems like an unforced error of him to sidestep around the question so obviously, because that really raised more attention to the question of whether or not the president was on oxygen and made it more easy for people to think that something was nefarious was going on.
Well, earlier, President Trump's physician, Dr. Sean Conley, also caused confusion by saying that the president had responded well to the treatment in the 72 hours since his diagnosis. But 72 hours would take us back to Wednesday morning, not Thursday night, as we understand it. So when exactly was it confirmed that the president had been diagnosed with COVID-19, Grace? And why does the timeline matter so much?
So the timeline really matters because the president met with people in person on Wednesday night in Minnesota and on Thursday at a fundraiser in Bedminster, New Jersey. So if he had known about his diagnosis before meeting with these people, that raises a lot of concerns about who could possibly have contracted the virus after meeting with him. So initially, Dr. Conley said 72 hours since the diagnosis. He later sent a memorandum to White House Press Secretary Kayleigh McEnany saying that he had misspoken, and he meant that it was the third day of the virus for the president, not 72 hours. CBS News has also confirmed from a White House official that the president first tested positive on Thursday evening. But again, it just caused a lot of unnecessary confusion with the timeline, where people weren't really sure when the president knew that he had the diagnosis, what he knew, and how serious it was. So it raised a lot of unnecessary questions.
Yeah, and there are also some conflicting reports, Grace, about whether or not the president was aware that his close aide, Hope Hicks, had in fact gotten a positive COVID-19 diagnosis before taking off to that fundraising event in Bedminster, New Jersey. If that is the case, then he was not following CDC guidelines about isolating until and clearly we understand that he did not receive that test until after he came back. So do we know anything more about that aspect of the timeline? Has there been anything that we can understand about whether or not the president went to this fundraising event knowing perhaps that Hope Hicks had in fact been infected?
So at the moment, what we know is that the president was informed that Hope Hicks had tested positive, and then he still went to the fundraiser in Bedminster. But the timeline, again, really is very fuzzy. So we're not quite sure exactly when he knew that Hope Hicks had tested positive, whether it was too soon for him to simply not go to the fundraiser, or what the whole situation was with Hicks in the White House and how recently he had seen her. So there's a lot of really fuzzy timelines around here, and frankly, we're just going to need to wait and see if the White House tells us any more about what's going on.
All right. Well, the Trump campaign has announced plans to hold in-person events with surrogate speakers while the president is undergoing treatment. Grace, what more do we know about who will be leading these events? And are they following the CDC guidelines to self-isolate for 14 days following exposure to a person with COVID?
Well, they're definitely not following those guidelines. Vice President Mike Pence has tested negative for the virus, but he is still expected to attend next week's vice presidential debate with Kamala Harris. And then the campaign announced that he will make a campaign swing to Arizona. The campaign also announced Operation MAGA, which will have the vice president and family members of Mr. Trump traveling to swing states, key areas over the next few days while the president is unable to travel himself. And if past his prologue, then there probably won't be any social distancing measures or enforced mask wearing. Because what we've seen over the past few months at the president's rallies and events is that there hasn't been a lot of social distancing, not a lot of people wear masks, and it doesn't seem to follow the CDC guidelines usually. So I would expect that in future appearances, we'll see the same.
Interesting. So as I'm hearing you, Nicole, or Grace rather, the campaign has not announced any additional precautions that they're going to be taking necessarily to prevent the spread of COVID-19. Is that right?
No, not yet.
All right. Grace Seegers, thank you.
Thank you.